Anxiety. Susan Dannon, LICSW, RPT, Minnesota Child Welfare Training System, Minnesota Department of Human Services, mn.gov/DHS. So as we start to look at what is anxiety, we need to understand that anxiety is actually a very normal reaction. Anxiety is fear that puts us on alert. It is biologically meant to keep us safe by alerting us to dangers in our environment. And so it does serve a purpose for us. The issue is that individuals with an anxiety disorder are in a state of alert with no direct reason or cause. So with anxiety disorders, this fear is excessive and it is also not always directly linked to an actual danger, but more of a perceived danger in the person's mind. So as we look at the anxiety, we're also going to look at the differences between behavior versus biology and mental health with this. So a behavioral issue in mental health is a chosen behavior that has a purpose to get a need met. So the child may be aware or unaware of the purpose of their behavior, but regardless of their awareness, the emotions and behaviors are impacted by the child's internal thoughts and feelings about themselves, others, and the world. And so based on these thoughts, they find a way to get their needs met. And so with behavioral issues and mental health, changes can be made with therapy, support, and time as the child is able to discover more functional ways to get their needs met. A mental health behavior is more of an issue where the child has an increased difficulty controlling their behavior despite their best effort due to biological factors. So in this instance, there are brain differences due to biology, such as chemical imbalances in the brain, neurological issues, or damage to the brain development because of trauma. And so in these cases with children, while therapy will be helpful as well, they may also need medication, more intensive support, and you may also need to accept that the child may not be able to change their behaviors as easily, and so instead, sometimes the environment is going to have to change to support them. So with individuals with anxiety disorders, 40% of them have a relative who is diagnosed with an anxiety disorder as well. And so we do believe there are biological factors that do impact anxiety with mental health. And with both of these, what we're looking at is that we need to set appropriate expectation based on the child's mental health needs. With anxiety disorders, while there are biological factors, there are quite a few behavioral issues as well. And so as we go through and talk about the anxiety disorders, we'll look at both medication and also therapy. Anxiety disorders are known to respond very well to cognitive behavioral therapy, and we'll be talking about that a little bit later. Another overall issue in children's mental health is considering culture. Cultural differences do impact how we assess, cope with, and treat behaviors and symptoms. So mental health professionals should take cultural issues under consideration and ask questions related to the context of the culture with mental health symptoms. And so what they need to look at is how problematic or accepted is a behavior or symptom in the child's community, family, faith, or social group. So for instance, there is a difference in Western and Eastern cultures about anxiety disorder. And so when we look at that, in Western culture, there's much more of a focus on independence, where Eastern cultures focus more on interdependence. And so there are actually specific anxiety disorders that are often diagnosed in Eastern cultures that are not even really considered in Western cultures. And so being able to know these differences and how that impacts how we look at the mental health becomes important. So if you are aware of cultural differences with your foster children, make sure that you make the mental health professional aware of these differences and just let them know what those cultural issues might be and how that might affect how they're diagnosing the child. So there's a great children's book called Wemberly Worried by Kevin Henkes. And the opening of the book says, Wemberly worried about everything. Big things, little things, and everything in between. Wemberly worried at night, in the morning, and throughout the day. At home, she worried about the tree in the front yard. What if it falls on our house? So, when we're talking about actually diagnosing children with an anxiety disorder, we look at the DSM. The DSM is the Diagnostic and Statistical Manual. And within that manual, there is a list of diagnoses that are based on research, and they are also based on Western medical practices, which is also the piece where the cultural part comes into. So in the DSM, there is a list of symptoms for each of the diagnoses that help determine whether or not a child or adult can be diagnosed with a particular mental health disorder. And you need to meet a minimum number of symptoms to be given that specific diagnosis as described in the DSM. So one thing to note is that DSM-5, the 5th edition, came out in 2014. And there were some additions to the anxiety disorders that were added. So we will look at kind of anxiety disorders overall, and then we will also look at these specific classifications. So the classifications for anxiety disorders now in the DSM-5 include generalized anxiety disorder, panic attacks, specific phobia, separation anxiety disorder, social anxiety disorder, and selective mutism. So the hallmark of all anxiety disorders is a persistent fear that something bad is going to happen. And those fearful thoughts play over and over in the mind, and the person feels like they can't shake those thoughts even if they want to. So in anxiety disorders, fears become overwhelming and intrusive. And oftentimes children will say that they wish they didn't worry so much and they wish that they could get the worried thoughts out of their head. So telling an anxious child not to worry is not really helpful. They already know that their anxieties aren't normal, and a lot of times they're often embarrassed that they can't stop the worry. So instead, we need to find ways to support them in understanding the anxiety and working on it over time. So when we talked about the fact that there are some biological factors with anxiety, what we're referring to is neurotransmitters in the brain. So the purpose of neurotransmitters is that they help send messages between nerve cells. And it is believed that issues with neurotransmitters do trigger many of problems with anxiety. So the two neurotransmitters that we believe have an impact the most as far as the chemical imbalance are serotonin and norepinephrine. So serotonin appears to specifically be important in feelings of well-being. And so when an individual has deficits in serotonin, they can manifest themselves in anxiety or depressive symptoms. The other one is norepinephrine. And what norepinephrine does is it dampens noise and increases the person's ability to think and reason. So norepinephrine is known to also be at lower levels for individuals with anxiety and with depression. So the generalized anxiety symptoms include excessive worry for the child's age, more days than not. So what this means is that the child is worrying basically on a daily basis, and that there's an excessive amount of the fear based on the child's developmental age. So it's normal for young children to have fears and anxieties. And if those fears and anxieties persist as the child ages and develops, that's where we start seeing it as problematic. The next symptom is there is an inability to stop the worry. And this is kind of like having a feedback loop in your brain. It's where the worry replays itself over and over again, and the individual feels like they can't stop that feedback loop and that they can't even distract themselves from that worried thought. And so it's kind of like a broken record that keeps playing the same part over and over again. With that, another one of the symptoms is irritability and agitation. So if you think about if you've ever been excessively worried about something, that this can cause feelings of uneasiness and feeling on edge. So if you think about a child who is very worried all the time, who is uneasy, on edge, then oftentimes that can trigger feeling irritable and agitated. And this often then impacts their ability to sleep. And because they're having difficulty sleeping, they become more irritable and more agitated. The other thing that we often see with children and adults with anxiety is complaints about headaches and stomach aches. So the thing is, our bodies often hold our anxiety. So things like tension headaches, stomach pain, low back, and hip pain are often associated with anxiety disorders. One of the other symptoms is that children with anxiety often have difficulty concentrating because they're so focused on their fears. So there have been times where I've had children referred to me where a teacher or a parent has thought that the child has attention problems or hyperactivity because they have so much issues with fidgeting and concentrating. And after we have looked at the situation and talked to the child, what we find out is that they're really anxious. So if you think about a child with a difficulty concentrating and the other symptom that's listed here, the difficulty sitting still because they're restless, kids tend to be very kinetic, so their body is more reactive than adults when they are feeling any type of emotional difficulty. And so they're going to be more prone to movement and restlessness than adults are with their anxiety. And so they're going to move around a lot when they're distracted. And I've often described this as anxiety kids oftentimes just really look uncomfortable in their own skin. They're very tense, they're fidgeting around, they look uncomfortable, and all of that has to do with the fact that they're so focused on the things that they're worrying about that their body and their mind is reacting to all of that. The other thing that we often see with children with anxiety is they tend to be very self-critical and have low self-esteem. So if you think about a child who is feeling out of control and negative about themselves, their anxieties can also trigger depressive type symptoms. So we frequently see anxiety and depression going hand in hand. And also from a biological standpoint, the norepinephrine and serotonin impact both anxiety and depression. And so we believe there is also a biological component where those two often go hand in hand as well. So, as I mentioned earlier, one of the things with anxiety is it often triggers issues with falling asleep at night, restless or unproductive sleep, waking up frequently, or having upsetting dreams. So, all of this can contribute to the child feeling very tired and worn out during the day. And if you think about that, if you've ever been very, very worried or anxious about something, anxiety and worry take up a lot of energy. So, the generalized anxiety disorder diagnosis in the DSM has to do with children who are anxious about a variety of situations. So, when I read the quote from the book Wemberly Worried, these are the Wemberly Worried kids. They live with a constant sense of dread that something bad will happen, and oftentimes they're not even sure what the bad thing is going to be. There are some kids with generalized anxiety disorder that have multiple fears about different things, and there are others that just have that general sense of dread. And oftentimes, these children will also be hypervigilant, so they will be very worried about things happening to them and very cautious and worried about doing something wrong that the bad thing might happen. Panic attacks are where the individual has an intense reaction to anxiety. And this manifests itself with difficulty breathing, the heart racing, feeling dizzy, or feeling numb. Panic attacks may be triggered by specific fears, but oftentimes children are not able to identify what triggered the panic. So, one thing that is helpful is to try to help them notice and become aware of patterns with their panic attacks. There are some children who have very specific reasons for the panic attacks, and that becomes a little bit more clear. One of the things to be aware of is that panic attacks feel very real and as far as a real physical reaction. And so they can be very scary to children and adults as well, because it is such a strong physical reaction that the individual has. There have been adults who have been known to go into the emergency room thinking that they were having a heart attack when they were really having a panic attack. And so that's how truly intense that feels. Another one of the anxiety disorders is what's referred to as a specific phobia. So, this is where you're fearful of a specific thing, such as snakes, spiders, storms, etc. So, with phobias, they may have been triggered by a bad experience, or they may also be internalized fears that the person has read about something or thought about something that impacts that excessive fear. So, the thing with these is that the fear is excessive and it interferes with their enjoyment of life. So, for instance, it's fairly normal for children and even adults to have fear of snakes. And it becomes considered a phobia if you have someone who is so fearful of snakes that they won't step in any type of grass or wooded area because they're afraid of a snake. So it's really about the fact that the phobia is interfering with their everyday functioning because it is so excessive. Another one of the anxiety disorders is separation anxiety disorder, and this is where the child is fearful of being separated from a caregiver. So it is normal for children up through about 2 to 3 years old to have separation anxiety when they are separated from a caregiver. And most children should grow out of that around the age of 4 or 5. So we are looking at a specific developmental age where this is considered more problematic than at other times. So with separation anxiety, the fear is normally centered around either something bad happening to themselves if they're away from their caregiver, or that something bad will happen to the caregiver if they are not with them. So separation anxiety disorder is one of the anxiety disorders that can be more common in foster children because they've already lost a caregiver in a sense by being placed in foster care, and so they can become very worried about losing that caregiver support with the foster parent, especially if the foster parent is a family member who they know and are attached to as well. So it's something to just be aware of and notice. Another one of the anxiety disorders is what's referred to as social anxiety disorder, and this is where the individual is fearful in social situations. And what this primarily has to do with is that they're often fearful that others are judging or criticizing them, and they are fearful of doing something wrong or looking stupid in front of other people. So with these individuals, they often avoid social situations and they may worry for days ahead of social events. And this is an area where we often will see panic attacks. So individuals with really significant social anxiety disorder can end up having panic attacks right before a social situation is about to occur because they have been worrying about and thinking about it so frequently. Selective mutism is a disorder where an individual chooses not to speak in certain situations. So a common manifestation of this would be what we refer to as stage fright. The difference with selective mutism is that it occurs more frequently in everyday social situations. And what occurs is that the individual will only be able to verbalize when they feel safe. I've often been asked if this is related to trauma, and while it can be, it is different than what we sometimes will refer to as traumatic mutism. Traumatic mutism is not technically a diagnosis. However, it is a way of kind of referring to when someone has gone through a trauma and will stop talking altogether because of the traumatic event. So some of the behavioral issues that you see with anxiety is that children with anxiety disorders can look oppositional because they will dig in when they're fearful. And so they will refuse to comply. However, it's good to remember that the child is not simply being oppositional or refusing to comply. It's really that they're motivated by their fear and not a rejection of authority. So, for instance, if you ask a child with an anxiety disorder to stop worrying about something or to do something that they're fearful of, they may refuse to do it. And it's not that they are challenging your authority, it's that they are so stuck in their fear that it's difficult for them to move past that. Some behaviors that we see in the school and community is that children with anxiety disorders often have difficulty transitioning from home to school. And this is especially true for those children who have social anxiety or anxiety about attending school. Or they may have that separation anxiety where they're fearful that something is bad is going to happen to their family while they're gone. And so it's difficult for them to go from home to school. And in some circumstances, it can also be difficult for them to transition from school to home because they're just constantly so fearful about something bad happening. And transitions are always a difficult time for most individuals. Another thing that we'll see with children with anxiety disorders is they will often have a repeated need to seek approval from their teachers. So, children with anxiety disorders, oftentimes because of those self-esteem issues, can become somewhat perfectionistic. So, they'll fear getting into trouble, so they will frequently check in and need to be reassured that they're doing things right. Another thing that you'll see is avoidance of peer or group activities. And again, this can be a fear of not being good enough, a fear of judgment. And so it's easier to avoid those situations. So it's not that they're being oppositional and refusing to participate in the group activities. It's that they are just so uncomfortable and so fearful that it's hard for them to do those things. So, along with that difficulty of transitioning from home to school, a more severe form of that is that the child will become reluctant to attend school or even refuse to attend school. And what we see with this is that they can actually become physically ill from their anxiety. And so you may also see those panic attacks. It may also just be them verbally saying that they feel like they can't make it to school. Another thing that you'll see is that kids with anxiety disorders often have trouble when their schedules are changed at home or at school. So, routine is very comforting to everyone, but especially for children with anxiety. So, changes in that schedule and that routine can trigger feelings that things are not right and therefore not safe. So, also, you'll see things like children with anxiety disorders having a very difficult time at school with things like fire and safety drills because that is taking them so out of the routine. And also, there are already normal fears around safety with fire drills and safety drills. And so that can trigger some of the child's anxiety as well. So, as we mentioned earlier, there can be a lot of issues with the anxiety disorder with difficulty concentrating on work, difficulty sitting still, and fidgeting. Also, with this, there are children who have specific issues with like test anxiety, where they can have even a harder time concentrating and fidgeting in testing situations because there's a greater risk of failure. And as we mentioned earlier as well, children with anxiety disorders, because of those sleep issues, are often tired and sleepy during the day. And so they will often show that in school as falling asleep in classes or looking very sleepy during the day. And because anxiety does increase those things of physical symptoms like stomach aches, headaches, muscle pain, anxiety kids will often have frequent trips to the nurse's office. The other thing with kids with anxiety disorders is that the nurse's office can become kind of a safe place for them to go to escape the day. And so sometimes we'll also see frequent trips to the nurse's office for that reason. Another one of the things that we see in the school and the community is kids not wanting to speak up in classes or in community settings. And this one often has to do with a combination of that social anxiety and or the selective mutism. So this has to do with that fear of how others may judge them. So things that you might see are children who have trouble giving class presentations, asking and answering questions in class, being introduced to someone new, and they may also have difficulty asking for what they need. So, as we mentioned earlier, there are biological factors that relate to anxiety disorders. And so these brain imbalances can be hereditary or they may also be triggered by traumatic events. So, with these chemical imbalances in the brain, psychiatric medications can be very effective in treating these symptoms. So you want to make sure that if you are needing to give psychiatric medications to the children that you have in foster care, you want to make sure that you give all the medications as prescribed. And you also want to make sure that you have a lockbox for the medications for your own peace of mind and also for the safety of the child. So there are two main categories of medications that are given to children and adults with anxiety disorders. The first one is the antidepressants. So as I mentioned earlier, the chemical imbalances that occur in the brain with anxiety are also the same chemicals that normally impact depression. And so antidepressants are used for both depression and anxiety disorders. So with those medications, they need some time in the system before they start showing significant improvements. The other category of medication are what are called anti-anxiety medications. In general, the anti-anxiety medications act quickly to slow down the nervous system. However, the thing to know about the majority of them is that they are normally short-acting and they can also have significant side effects with long-term use. So they are normally just given on an as-needed basis for specific situations. So if your child is given any of these medications, you want to make sure that you ask questions about it and get clarifications on what the purpose of the medication is and how that will work. So one of the things that I like to look at for children is what is referred to as the crucial C's. So the crucial C's were developed by Betty Lou Bettner and Amy Lou. And they're from a book called Raising Kids Who Can. And what they identified is there are 4 basic crucial C's that we all need to feel positive about ourselves and our lives. So the first one is courage, which is our ability to accept challenges. Count is our ability to feel like we have a purpose in life. Capable is that you feel like you are able to do things, that you can figure things out. And connect is about having a sense of belonging, that you have some place that you feel accepted at. So with that, children with anxiety disorders often have struggles in their crucial C's. So a child who is struggling with the crucial C of courage will be too afraid to try new things. And so they can be very stuck on any time that they're asked to try something new or to get out of their comfort zone. Kids who feel like they don't count, feel that they're worthless, that they don't have a place in the world, that they don't have any meaning or purpose. And so those kids with anxiety who also have self-esteem issues will often struggle with the count. The capable piece for children with anxiety is that they will be fearful that they are not good enough and that they're not able to figure out things. And so oftentimes this can be also about their perfectionism and being afraid that they're not going to be able to do things well enough, or that they're going to try something and they'll fail at it and then they will be embarrassed. And then the crucial C of connect for kids with anxiety is oftentimes those kids who have the social anxiety disorder. So it's that fear that no one is going to like them. They'll get hurt if they try to connect to other people, or they may be afraid that others are going to reject them. And it can also be that piece about being fearful that they're going to do or say something stupid in front of others. So what I like to look at with this is looking at what are the crucial C's that the child is struggling with, and also what are the crucial C's that they are strong with. Because what we want to do is find a balance of how can we use the crucial C's that they're strong with to shore up the crucial C's that they're struggling. So, for instance, if I have a child who has an anxiety disorder who is really struggling with the courage piece, that they're afraid to try new things or work outside of the box, and they are a child, however, that is strong with their ability to connect, then what I may do is pair them up with another person when they're trying new things, because that's going to give them more comfort. And because they have a strong connection to this person, they may be more willing to try something and move them past that fear. So it also can be a really helpful way to look at and explain to therapists and teachers in regards to what you see the child struggling with and what also are their strengths. So one of the other things that's really important with kids with anxiety disorders is to give them a lot of encouragement. And one of the things that I like to look at and explain is that there is a difference between praise and encouragement. So praise is external, it is giving approval, it's about what others think is good. And in a sense, it's kind of like giving that gold star or that sticker. Whereas encouragement is more internal. It's inspiring others to be their personal best despite how others might judge them as good. So praise is saying things like, you did a good job. Whereas encouragement is more about saying things like, you look proud of yourself. So rather than me saying you're good, it is helping the child internalize that they should be proud of themselves and notice their own sense of good. And so it's helping them identify for themselves when they feel good about what they're doing and helping them see that. Because since one of the struggles with children with anxiety is that they're often worried about how others are judging them, it's important for them to come to a sense of knowing when they are doing things well enough so that they are not so overly focused on what others are thinking of them. So one of my favorite quotes from Rudolf Dreikurs is, children need encouragement like plants need water. So if you really want to see a child grow and blossom, give them a lot of encouragement. So with encouragement, what we're wanting to do is reflect on the child's values, their progress, and their asset. And avoid using words like good and great. So a lot of our kids in foster care have low self-esteem, and this is especially true with those kids with anxiety disorders. And so they feel like they don't meet everyone's standards of good. So our job is to help them see the good in themselves, to notice the things that they value, to notice the progress they're making towards their goals, and to notice their strengths. And a lot of this has to do with the fact that society tends to focus on the end product. And so we kind of tend to look more at how did the child finish something. And with kids with anxiety disorders, we really want to focus more on their journey and the steps they're taking. So it's about the fact that, wow, this week you were able to do this piece, or you were able to show that you had courage by trying something new. And so even if they don't meet other people's standards of what they may consider good, that they're able to see that, like I said, that good in themselves. So instead of saying good and great, the things that we want to say are things like, that's important to you. You were able to figure that out. You really know what you want to do. You thought that was too hard and you were able to do it. So we want to take notice of what they're doing and point it out. You look proud. You really focused on that. you picked out a lot of colors for that picture. So one of the things, especially with children with anxiety disorders, is they will often ask you for praise. So they'll ask, do you think I did a good job? Because they're looking for that reassurance and that approval. So one of the things that I often do with that, with children with anxiety, is say something like, first, tell me what are the reasons you think you did a good job. And have the child give their opinion and then affirm what they've said. So it sounds like you really worked hard on that and you feel proud. And that's really what they need to hear rather than just needing your approval, saying that you think they did a good job. Along with that is because children with anxiety see themselves oftentimes as not good enough, they assume things are going to go badly and that they will fail if they try things. And so one of the other messages that they need to hear is that they need to have the courage to be imperfect. So the message is that being imperfect is being human. So it's okay to try new things. It's okay to have that courage. It's okay to spend some time trying to figure things out. And it's okay that when you take those steps, that sometimes you may fail. And the thing is that mistakes are not failures. Mistakes are aids to learning. So mistakes are unavoidable, and in most cases, they are less important than what the individual does after they have made the mistake. So this requires the courage to be imperfect, requires the realization that I am no angel, that I am not superhuman, that I make mistakes, that I have faults, but I am pretty good because I don't have to be better than others. So that's just a really important message for kids with anxiety disorders, is that it's okay to not be perfect. So there's a really lovely book about this for younger kids, although I have actually used it for adolescents and adults as well. And it's called The Beautiful Oops by Barney Salzberg. So the entire idea of the book is that even a mistake can turn into something amazing. And so as you go through the book, it gives different examples of mistakes that artists have made and then how they turn that into a beautiful work of art. The other thing with the courage to be imperfect is that we need to model our own imperfection for kids with anxiety disorders. So if you mess up in front of one of your foster kids, admit it and then demonstrate how to correct the mistake. Kids really do learn by example, and so if you can also show your courage to be imperfect, that can really help the child as well. Another way to help children learn to manage anxiety is by returning responsibility to them. So returning responsibility to the child is a way of encouraging the child to take responsibility for him or herself and encouraging them that you believe they have the ability to succeed. And so the principle behind all of that is that you do not do for children what they can do for themselves. So anxious children will often say things like, I can't, because they're fearful and they're afraid that they're going to fail. And so what we want to do is avoid rescuing the anxious child, because when an anxious child says they can't do something when we know they really can, and we step in and do it for them, what we're doing is really reinforcing the fact that we do feel that they are not capable. So instead, we want to be able to take a step back and encourage them to figure out how to do things on their own. So some things that you'll see with this is a child who is quote unquote asking for help. So they may ask for help with a behavior, and so it may be that they're explicit what they're asking, saying things like, can you tie my shoes? Or it may be more implicit where they simply say, I can't tie my shoes. And so they're hinting at the fact that they want you to tie them for them. And then behaviorally, you might see a child who keeps pretending to try and tie their shoes with no success in order to have someone come and rescue them and tie the shoe for them. Help with decisions has to do with kids who are anxious and will ask you to decide things for them. So if you have a child who's coloring a picture, it might be that explicit asking, what color should I use? Or the implicit, I can't decide on the color. Or you might have that child who behaviorally just stands in front of the blank picture with their crayon in hand, waiting for someone to come and rescue them and giving them a hint about what they should be doing. So the way that you return the responsibility to the child is saying things like, you would like me to, and I think you can. I bet you know what to do. You seem to want me to decide. Today, you get to decide. You seem frustrated or unsure, and I know you can figure this out. So, with all of these, what you're trying to do is acknowledge the feeling and then let them know that you believe in them and you believe in their capabilities to solve the problem. Now, there are some times where we will not return responsibility to the child. So, this is when a child is not capable. So, for instance, when I mentioned the issue with the tying the shoes, there have been some kids I've had who were 8, 9, 10 years old where they would say, I can't tie my shoes. I would encourage them, return their responsibility, saying, I think that you'll be able to figure out how to do that, or I believe that you can tie your shoes. And then I find out that they really can't tie their shoes. And so, in those instances, what I'm going to do then is to try to collaborate with them. So, let's try to do this together. Or to say something like, well, I've seen other kids try to do it this way. And so then it becomes more of a coaching situation where I'm supporting the child in their ability to figure it out. The other time we're not going to return responsibility is because of the child's history. So if the child has fears due to trauma, or if they are needing some extra nurturing, which can include that last one, the current situation, they've had a bad week, then I may step in and do something for them. And in those circumstances, what I'm going to do is say something like, I know that you can do this, and I know it's really hard for you today, or I know that you've had a bad week, or I know this is something that you've struggled with, and so I'm going to help do that for you. And so then it becomes more that you're doing it for them out of nurturing and support rather than you not believing that they can do it. Something that can be very positive for kids with anxiety disorders is nurturing and especially positive touch. Kids with anxiety can be helped through these kind of nurturing and calming activities. And nurturing touch is a great way to connect with them. It provides a good way to encourage them, to soothe them, to calm them. And so, if you think about a child with anxiety disorder where their central nervous system is very activated with that anxiety, nurturing touch can be something that really can calm that nervous system down very quickly. So, the one thing that you do want to do with kids with anxiety disorders, and especially if they're in the foster care system, is check in with them about what kinds of touch feel safe and calming to them. So, it can be simple things like rubbing their hands with lotion, dancing with them, putting a hand on their shoulder as a physical reminder, giving high fives, fist bumps, or having a special handshake. So, as I just mentioned, the nurturing is also about calming the central nervous system. So, if a child with the anxiety disorder goes into the point where they are getting very panicked, and even those kids who start in on having the panic attacks, one of the best ways to help calm the central nervous system is to get them grounded. And what that means is to have them sit down, feel the ground under them, where they can really feel that centering again. Another thing which happens to be in your handout is a pressure point handout about the pressure point on the forehead. So there is an acupuncture, a known area on the forehead in the center where there are a lot of nerves. And so pressing on that can have a very instant calming effect. And you can teach the child to press on that center of their forehead and take some deep breaths themselves. And or with permission, you can put your hand on their forehead and give some pressure and have them do the deep breathing. And this is a way to oftentimes help them calm down very quickly when they're having that really rapid breathing that goes along with that central nervous system becoming very anxious and very agitated. The other thing that can be very helpful for children with anxiety is yoga movement. The reason for this is yoga movement helps the child become much more aware of their body sensations. There's also a lot of focus on the deep breathing, which is really good for kids with anxiety because deep breathing helps the nervous system calm down very quickly. And especially for kids who become so anxious that they start having that really panicked, quick breathing, knowing how to breathe slowly and deeply and how to slow down that breath can become a very important way of them learning how to nurture and how to calm themselves as well. And it helps them get out of that fight or flight response. So if they've practiced being grounded, they can learn to find the ground when they're shaken, to release those responses, to nurture themselves, and to feel strong again. Now, as I mentioned earlier, there's also the fact that kids with anxiety disorders have a really hard time calming themselves before bedtime because bedtime is a time where they're often very anxious, they have difficulty sleeping, they have the nightmares, the bad dreams, and they start worrying about things. Because if you think about when you're going to bed, that's a time that's quiet, and so it's a time where they often start hearing those worried thoughts repeat over and over again in their mind. So, with the nurturing at bedtime, creating a bedtime ritual to calm their senses. So, rubbing their hands or feet with lotion, soothing smells like lavender can be especially helpful, listening to nature sounds or music, reading to them, doing yoga poses that calm, warm milk or warm bath. So anything that is warming, nurturing can help with that grounding and relaxation. And then also there are reading relaxation scripts. So with relaxation scripts, what they have found through research is that if you can close your eyes and imagine yourself in a relaxing place, it actually will decrease your stress hormones. It increases a sense of well-being, it slows down the breathing, it slows down the heart rate. And so if you think about a child who's anxious and having a difficult time settling down for bed, being able to do that and find that calming place for them in their mind can be very useful. So in your packet, there are 2 relaxation scripts. One is called the Magic Shell Meditation. That one is for younger children with anxiety issues. And then the one that is labeled the Big White House is a script for children with anxiety that are older. So older elementary and adolescent children, that one can be very useful for. Another one that is in there is what's referred to as back breathing. And this is helping the child use those deep, calming breaths. And so it can be a lovely activity to do with kids before bed. And it's also a way to help teach them some co-regulation. So if you look at that handout, it gives directions on how to do that. But the basic idea is being able to put a hand on the child's back or sit back to back with them and breathe together with them, those nice, slow, deep breaths. And so they feel and they hear your breath and they feel and hear their own breath. And so helping them kind of breathe together with that deep breathing. So the last portion we're going to look at is interacting with schools in regards to kids with anxiety disorders. So what you want to do is work with the teacher to understand the child's anxiety, the type they have, the medications that they're taking, what they're capable of, and any therapy recommendations. The other thing is that there are a lot of teachers who have already worked with kids with anxiety disorders, and so asking them for suggestions can also be very useful as well. And you want to advocate for your foster child. So if there is a lot of anxiety about work, about test anxiety, if homework is taking them a really long time despite their best efforts because of their anxiety and their fears about either not doing it well enough or they're so distracted because of their anxiety in school, talk to the teachers about adjusting their work or extending time for tests. Some things that are known that can be helpful for kids with anxiety disorders in the classroom is seeing if the teacher will allow fidgets. So being able to have something in their hands that they can rub or they can move around can help decrease anxiety because it gives a place for all that kinetic energy, those body reactions to go to. Another thing that is helpful is allowing kids with anxiety disorders to have a cool down pass. So this is where they can give a pass to the teacher so that they can go to a place inside or outside the classroom where they can decompress. And oftentimes we've set up a kind of a calming toolbox for the kids. So having things in there that help ground them and calm them, relaxation scripts or music that they can listen to. And then we want to really look at with the kids with anxiety in school to encourage their effort and not their outcome. So having them focus on doing their personal best. The other thing is in your packet, there is also a handout on sample accommodations for anxious kids. So it talks about some different things with seating in the classroom, following directions, class presentations, the lunchroom. It gives a little bit more of a description of the cool down pass, how to handle testing conditions for kids with test anxiety, field trips, those fire safety drills, homework expectations, and how to help them kind of handle changes in routine. And so those can be very useful for yourself, and they can also be things that you can share with the teachers as far as recommendations or suggestions that might be helpful for your foster child. And then the last thing is if you feel a child is not getting their needs met in their education system, children with anxiety disorders may qualify for special education services. So talk to the school and talk to your foster care worker or tribal worker if you feel that the child is going to need more significant accommodations to help them be successful in school. So thank you very much for listening to this seminar. Minnesota Department of Human Services, mn.gov/DHS.